Hello everyone, and welcome to the 6th Talking Tuesday video series where we review frequently asked questions and topics specific to health links and coordinated care plans. In this session, we'll be talking about maximizing the care team approach by sharing coordinated care plans. The first frequently asked question is, why is it important to share coordinated care plans? This is a question that may seem straightforward to some, but we will be going through all the benefits. So this will be useful in your own practice and also when having conversations with others about coordinated care plans, whether this be internal to or external to the organization that you're working for. The first reason why it is important to share the CCP is that it improves collaboration and communication amongst the care team as well as the client. Everyone on the care team is using the same standardized tool for communication, and everyone is working towards the same client-centered goals. If everyone is aware of what is going on with the client, there's less confusion in regards to the client's care, and the care team members really do have a clear understanding of the care and the services that everyone on the care team is providing. When roles and responsibilities are clearly outlined, this provides some accountability to the rest of the team. It also reduces duplications of documents, services, referrals, and everyone's time. Next, it really allows the care team to know when changes have been made to the CCP, which results in providers having a consistent understanding of their client's needs. Sharing the CCP with the client can provide a sense of empowerment and control over their healthcare journey. So when you do share a printed version of the CCP with your client, ensure that you write or stamp the words client copy on the client's CCP and any other of their documents so that if they were to be found in a public place, it would not be a breach of privacy. Sharing the care plan also creates ease when navigating through various social and health services. So for instance, thinking beyond the traditional treatments the client may benefit from, so for instance, financial resources, welfare, food banks, educational resources, holistic therapies, and any other support groups or programs. Sharing allows for care to be focused on the client's goals rather than the provider's. So in the previous sessions, we did talk about the importance of the client's voice and why it's so important that the goals are meaningful to the clients themselves. If the goal stems from the provider as opposed to the client, the individual may feel that they're not capable of achieving their goals, they may feel discouraged, or that their goal is not feasible. And it really does prevent them from having that autonomy over their own successes. So this is something that we really want to avoid. Sharing the CCP allows the client to feel more supported, and it also reduces the number of times the client has to tell their story and their healthcare journey. For example, when an individual visits an emergency department, most of the time they have to tell their story to the triage nurse, sometimes the primary care nurse, potentially the resident, the physician, and any other specialist that the client comes in contact with or speaks to. This can be very exhausting to the client, so having that care plan is an example of where this could be very beneficial to all providers. The only time that you will not share the coordinated care plan is if the client has clearly identified that they don't want to share it with a particular person or organization. They should communicate this to the integrated care lead or other care team members. If this is the case, make sure this is clearly written or documented on the client's consent form for everyone to see. The next question that we're going to review is, how can I share the coordinated care plan with someone who is not on HPG, but I am? So first you want to ensure that you have the client's permission to share the coordinated care plan. Then you can use the most common or preferred method of sharing the coordinated care plan, which can be either through fax, by phone, or through hand delivery. If you are on HPG and are sharing the coordinated care plan with a partner who completes them on paper, you will need to save the CCP in a PDF file format, print the CCP so changes cannot be made, then share the CCP via fax or in person. You want to consider giving the care team members a call to provide any additional context about the client or their care plan. As far as emailing the CCP, please note that you must be in compliance with your organization's privacy policy and procedures. So it is recommended to consult with your own organization's privacy department to find out whether this can be an option for you. Next, we're going to take a look at how can I share the paper CCP with someone who is on HPG, opposite to what we were just previously talking about. As we did mention before, there will be some times when not all organizations or members of the care team will all have access to HPG and will be completing CCPs in the paper format only. We see this quite often and have been able to assist in navigating these common situations. Although care team members may be on different platforms, it can still be a simple process to share the CCP with others on HPG. As previously mentioned, every organization has different policies and procedures regarding sharing personal health information via email, so we really do recommend to consult with your own organization's processes in this regard. We encourage case conferencing and communication in establishing clear roles and responsibilities when working in both paper and electronic formats. We want to keep the process simple and straightforward for everyone. The paper copy of the CCP can be shared either by fax or by providing updates in person so that those with HPG access can make quick and simple updates whenever needed. When creating the CCP and having discussions with the other care team members, the case conference is a great opportunity to identify who on the care team can transcribe the CCP into HPG so that it can then be shared in real time electronically. If your client has a LIN Care coordinator, you can fax them a copy of the paper CCP. It can be uploaded into a document system embedded within CRIS as a PDF file. This is not viewable or accessible through HPG or Clinical Connect, and it is best to fax it to the LIN's main number, as this will ensure it is added to the system correctly. Next, we will address how often do I need to share information and what information do I need to share. So we do know that communication is a key factor in making the CCP a useful and collaborative tool. It is meant to be an evolving document that includes sharing of information throughout the entire process. In terms of frequency, it is recommended that you share pertinent information as often as needed, as it does pertain to the CCP, or when you think that others on the care team need to be informed of changes in the client's status or goals. Information should be shared throughout the client CCP journey, such as when a new integrated care lead has been identified, when the client transitions to self-management, when care team members have been added or removed, when changes have been made to the CCP, when there has been progress made in achieving the client's goals, and when the goals have been achieved or if the goal has been again added or changed. For those that are not able to share information on HPG, a real-time notification will be sent to others on the care team that also have access to HPG. Remember, you want to use your clinical judgment, and if you think that others on the care team should be updated and informed, then please feel free to do so. You can do so by editing the care plan in HPG if you do have access to it. You can also contact the integrated care lead, or share the updates via fax, in person, or over the phone. The last question we will discuss is when should you communicate with the client's primary care provider? So for instance, the family physician or the nurse practitioner. Primary care providers do play an integral role in the client's healthcare journey and should always have the opportunity to be engaged in and inform the coordinated care planning process. As part of the resources including in the HealthLinks channel, you will find the HealthLinks primary care provider letter. So one is for the CCP on HPG, and then the other one is for CCPs that are in the paper format. You can fax this to the primary care physician's office. When a CCP is initiated and the care team is being built, be sure to send this letter indicating a CCP has been initiated, and you can invite them to be part of the care team in care conference if the client has agreed. Billing codes are also outlined in the primary care letter on the second and third page. So you can just see an example here on the screen. We want to encourage our clients to self-advocate and feel empowered throughout their healthcare journey for informing healthcare providers, including their PCP in that they have a coordinated care plan in place. The client can share their copy of the CCP or can provide the primary care provider with the ICL contact information. As you likely already do in your current practice, if there are concerns about the client's medical or social status that aren't able to address by members of the care team, then communicate with the primary care provider is highly encouraged to ensure the client receives the services that they truly need. And lastly, we'll be going over some key takeaways for you to take away from session 6. Sharing the coordinated care plan ensures increased collaboration, clear communication between the client and all members of the care team. It reduces duplication of services and referrals, strengthens partnerships, and everyone really knows their roles and responsibilities as it pertains to the CCP and the patient-centered care. Sharing the CCP provides better quality of care and greater client navigation across sectors. It has the ability to improve population outcomes and health management. Sharing the coordinated care plan with others can be done through Health Partner Gateway. It can be done in person, via fax, or through business approval forms of secure email or mail. Information should be shared with others on the care team when there is a major change in the client's health or social status and or when goals have been met, added, or changed. Communicate with the client's primary care provider when a CCP has been initiated, there is a change in the client's status, to invite them to be part of the care team, participate in a care conference, and really encourage the client to inform their primary care provider of their coordinated care plan. Thank you very much for tuning in to session 6, and stay tuned for session 7.